Miranda.
And I'm Delaney, and we are Hand Therapy Academy.
Well, welcome, Delaney. We have Delaney with us today. She has been working in hand therapy for 2 years now, and she works at one of our clinics that is more neuro-based, but still sees a fair amount of orthopedic conditions. So she's going to come on and talk about some interesting cases that she's had, and we're just going to chat about exercise-induced compartment syndrome, or whatever she wants to call it.
Yeah, so actually it's called chronic exertional compartment syndrome, which I had actually never heard of until I came across a patient of mine who was actually diagnosed by a doctor in, I believe it was Florida, and with chronic exertional compartment syndrome of the first dorsal interossei. It was very interesting. He came in with super hypertrophied first dorsal interossei bilaterally, with the right more affected than the left. It was his dominant hand. And I was like, whoa, this is kind of like crazy. I've never even heard of this. I've heard of like compartment syndrome, but I was like, whoa, is this a medical emergency? And obviously it wasn't. But yeah, so it was a very unique case and very cool to see. I think I remember texting you and asking you if you had ever heard of it.
Yeah, and I think I had one patient that had it in an extensor compartment, and he was doing a lot of playing an instrument, so it would happen at that time. And we just did a lot of biofeedback and muscular re-ed type stuff. But I think what is interesting, or what I want to ask you about, is how did the doctor in Florida make that diagnosis?
I actually don't know. I think that what I found in my research was that you have to diagnose it by like measuring the intercompartmental pressures. So I don't know if she ended up doing it that way or how she ended up doing that, but I'm assuming it was with that. But
yeah, it's interesting because the cases I've seen have just been based on like a high suspicion of that being the problem.
Yeah, and that very well could have been what she did. I didn't ask the patient how she ended up diagnosing that, but yeah.
That'll be interesting. Okay, so what did you do for treatment? So the doctor that diagnosed referred the patient to hand therapy then?
So he received, or he didn't receive hand therapy in the state he was diagnosed. He ended up moving to Arizona. It caused him a lot of pain. He liked to play racket sports as well. So when he was playing those, he would have a lot of pain, and he kind of like, it got to where it was so debilitating that he couldn't do that anymore. And so he ended up searching out for a hand therapist, and he saw us, and he did not want to have surgery. He was very like adamant that he didn't want to have surgical intervention. We ended up doing a lot of biofeedback stuff, and that actually really helped him control the pain and like learn how to use his like first dorsal interossei and his like different pinches without aggravating symptoms too much.
Without firing that muscle.
Yeah, and he still would fire it when we used like our biofeedback. We used the M trigger. And he would still fire it, but the like levels were much, much lower of like muscle like activation.
Yeah, that's interesting, isn't it? Because sometimes I feel like when we're doing exercises, people will favor one muscle like stronger than the other. So yeah, obviously he was probably one that would always try to use his first dorsal interossei, where maybe other people wouldn't.
Always, yeah.
I was kind of curious of what type of occupation he had, or if there was anything he did other than racket sports that would irritate it.
Well, actually, he was kind of like in between jobs and just kind of like doing what he like his passions in life. So he actually was doing some comedy stuff, so stuff that he wasn't really using his hands. To be honest, it was mostly the sports that he was complaining about. Yeah.
Well, I mean, that's the other thing too, right? When people have like these dramatic lifestyle changes, or where they may go from like being like sedentary at a desk and then all of a sudden working out a lot, or maybe they weren't very active before and then they started picking up racket sports or something, then they may have conditions, which I see too. Like when I'm playing pickleball, people will come out and they'll be like, oh, my elbow is really hurting, but it's like, well, you haven't exercised in, however long. And now.
Yeah. And now you're at it.
Now you're at it 4 or 5 hours a day. That's not healthy.
No. Yeah, no, not at all. And then they go from, literally 0 to 100 really fast.
Yeah. Yeah, we see that a lot. So I think a lot of times too, like for those patients, even though, yes, they can go to the doctor and get a diagnosis for a specific thing, but a lot of times it's just like really when you're evaluating the patient, is really listening to them and, like learning about their lifestyle and what they're doing, right? And seeing what the changes in their lifestyle have been. And then like, oh, okay, well, I think you don't need to slow down. And maybe you don't need to grip the paddle that hard, especially if you're new. You don't need to grip the racket or the paddle that hard.
Yes, exactly.
Yeah.
I did have another patient of mine who he came to me with very similar symptoms. It was just like in his thenar eminence, and he was actually a doctor in the ER, and his like every time that he was like typing or on his laptop, his thenar eminence bilaterally, but more so I think it was in his dominant hand, would swell up, kind of same thing. And I was like, oh, this is just like my other patient. But he just wanted to see like what I thought, and he actually was in concurrence. He said he had heard of that. I just kind of brought it up. I was like, there's this thing that's really rare, especially in like the hands. It's more so common in like the lower extremities, but he had actually heard of it in his own research, and he was like, I think I'm going to seek out treatment and a medical diagnosis from like an MD. But we emailed back and forth after that initial evaluation, and then I didn't hear back from him if he ever got that diagnosis. So,
Interesting.
Yeah.
I know. And then you wonder, should you like immobilize that area while the inflammation goes down, and then,
right.
Yeah. I mean, that's probably what I would be like, depending on how bad their pain is. I'd probably be inclined to have it rest and then get some of the inflammation down and then gradually work into some of those tasks that they're doing again.
Yeah, that's true. And I didn't try that, but it very well could have worked. I only saw him the one time, unfortunately.
Yeah. No, that's hard when it totally, especially when you're trying to figure out what's going on. And if they're coming to you for your thoughts when they don't have a diagnosis already, then
Yeah.
You're like, I need to look some stuff up.
Yeah.
Yeah. I think that's like the fun thing about hand therapy too, is there's always something new to learn.
Always learning every single day, every time you come into the clinic.
Every day. And I feel that after even being in for 20 years, so.
Yeah, I could see that for sure.
All right, Delaney. Well, thank you for sharing your case. And if you're interested, or if anyone is interested in learning more or sharing their cases with us, please email us info@Hand Therapy Academy or reach out to us on Instagram @Hand Therapy Academy.